I think the majority of people who come to the CyberMed Summit, they're here to learn. They want to be on the cutting edge of medicine at the intersection of cybersecurity to really understand what would happen when a cybersecurity event happens to a hospital or happens to a medical device.
When you come, you're going to meet lots of people who are passionate about healthcare cybersecurity. You're going to meet them from all different walks of life. You're going to meet regulators from federal agencies. You're going to meet medical device manufacturers. You'll meet hackers. You'll meet patients. These are the types of people that come, all working together to make healthcare more secure.
My husband told me about it, and we thought it was a good combination of both of our career fields. I'm a nurse, and he's in cyber.
I personally work in cyber at the nexus of health data and cyber.
I'm in the cybersecurity realm, and I'm increasingly concerned about interconnectivity of medical devices and the risks that brings to bear.
I come to CyberMed Summit to connect with colleagues and hear various perspectives, whether it's from clinicians, regulatory folks, government, and see how far we're moving the needle in cybersecurity for medical devices.
We've been working on healthcare cyber safety for 10 years, trying to put it on the map. The world's gotten a lot more dangerous since we started, and I think in some ways we are getting political will to finally take cyber safety and cybersecurity seriously.
Government, including the executive office of the president, is an active agent for change, and change is needed.
And we have a sitting congresswoman, a sitting congressman. We just passed a law called the Patch Act, so we made a lot of progress, and there's a lot more work to do.
So the main event at the CyberMed Summit is clinical simulations. This is when a physician walks into a simulated clinical environment.
73-year-old male complaining of left-sided weakness.
An encounter with a patient who is an actor. They're working through a script, and all of the support staff are doctors, nurses, and others. They also know the script. The idea is that we want that physician who's going into that encounter to really have an understanding of what it's like when there is some type of a cybersecurity event that may happen. So the simulation that we ran earlier today was one where several of the clinical systems were down. Radiology was down, labs were down, the cath lab was down.
This patient couldn't go to the cath lab, they're going to decide to give what are called thrombolytics or lytics. That is not the ideal therapy, but it's the best they can do under the circumstances. And the side effects, if you're wrong, are bleeding and death.
The doctors were able to work through it and eventually got there, but it was a lot more intensive. It took a lot more guesswork. And their conditions may have been much worse than if those devices and systems were available for use.
What do you think was going on?
When I looked at the computer screen that was on the laptop, I was like, oh, this is like a cyber attack.
It was a little panic-inducing when I didn't have some of the stuff that I normally use in the emergency room. That's the biggest thing that I learned is that, when these systems go down, now all of a sudden I'm operating without the information that I really need, like an image of somebody's brain or getting somebody to definitive care. So it's suboptimal care that I'm delivering if I don't have these systems, which is a little bit frightening.
I've been in medical for 12 years at this point, and as we talk about these ransomware attacks, are we training our newest nurses, our newest physicians, how to operate in a downtime environment for an extended period of time? We all do it when there's updates for EHRs and the glitches in the system, but what happens when it's lasting 2, 3, 4 days? How are we going to safely take care of our patients?
We basically have a tale of two healthcares right now. Those who believe we are doing the best we can, and those who know we are not. And we've tried to assemble the heroes and the creative thinkers here that are in the latter camp that know we need to be better because the public is counting on us.
I'd say this is a really great place to learn about this industry. So, there's both medical professionals here and also cyber professionals here. So it's really the best place to get the best of both worlds.
Everybody's had a nugget of wisdom that I'm bringing back with me.
If you care about patients, if you care about cybersecurity, or if you even don't know that yet, you should still come to CyberMed. We welcome people from all walks of life, all specialties. If you take care of patients and you interact with technology and you're passionate about making patient care safer in a hyper-connected world, CyberMed's for you.